So today we'll be discussing about the miscellaneous condition of external auditory canal, and the first one to discuss is nothing but the impacted vats or the impacted cerumen. Okay, now first let's discuss what are the contents of vats. So secretions of sebaceous and ceruminous glands, next is hair, then desquamated epithelial debris and keratin and dirt. So these are the contents of vats. Okay, generally vats is a protective function. It is having a protective function because it helps in entrapping the foreign material. Also, it is having a bacteriostatic and fungistatic property in that. Okay, now how it happens, how does the vats get impacted? So in those person who is having more sweat, there is a tendency of production of more cerumen or vats. So in that case, it gets deposited as a plaque in the external auditory canal. Okay, in other reasons are narrow and tortuous canal, or it could be because of a stiff hair, and it could be because of obstructive lesions like echostosis or osteoma. Okay, now what are the symptoms? Who is having impacted vats or cerumen? Definitely the first one will be impaired hearing, which may be noticed by the patient. Okay, then the next one is the blocked ear, or then if the vats is impacted over the tympanic membrane, the patient may present with tinnitus and giddiness as well. Okay, then there could be reflex cough because of the Arnold nerve. Okay, now if there is a long standing case of impacted vats, it can lead to ulceration leading to vats granuloma. Okay, so this you can remember. Now what are the treatment in this case? Definitely oral syringing, then instrumental manipulation, and by if the vats is hard, then we can go use of vat solvent like 2% para-dichlorobenzene. Okay, now let's see what is syringing. Syringing is nothing but oral syringing. So a stream of water directed along the posterior superior wall. So this direction is very important because the other directions may produce a reflex cough and other problems, or it may even get the vats more impacted and pushed towards the tympanic membrane. So this stream of direction, that means the direction of the stream is important here. Then of course the water taken, it should be boiled tap water which is cold to body temperature. Okay, now let's see what is the instrumental manipulation. So instruments that we use are Cerumen hook or Jobson horse prop. Okay, so these are the very common instruments that we use to remove the vats from the meatal wall. Okay, so that's it. So that's about the impacted vats and cerumen. Hope you got an idea. Thanks for watching.